came in. It was a 5 and a 5 marks question, 10 marks long question. So anybody, can you tell me, like, has these questions related to BMOH and situation analysis? Any kind of situation can be given, right? The one that came up, I'm going to discuss that right now. Apart from that, also there can be other situations. Has it been discussed in your college? Any sir, anybody? That you have an idea, or do I need to like start it right from zero? Any leads, anyone?
We had discussed about the investigation of an outbreak previously, like for food poisoning or infectious disease.
All right. So I think I will take over that also, since Akanksha said that. We will go ahead with that later. Right now, let me just then start, because see, there will be a lot of there are variations in this question. One question, as you can see, is a declining sex ratio. There is another question maybe saying that there is an increasing rate of infant mortality. I mean, increasing infant mortality rate reported in your block. How will you investigate the situation? Then another question can come that there is a decreasing couple protection rate in your block. How will you investigate the situation? There can be another that, as you said, epidemic, right? So there can be another question which Aditi ma'am said. I mean, it came during her exams itself. That there is going to be a mela or a festival in your village. As a BMOH, what measures will you take to ensure that the festival goes like smoothly? What are the potential precautionary and preventive measures that one needs to take? So these are variations. I will explain a couple of questions today, and maybe you can, taking that framework, I will expect you to frame answers to some other questions which I will provide you as homework, right? So this is the first question. Yes.
Ma'am, can the question be answered according to health planning cycle?
See, health planning cycle depends on, see, if you read this question first, then you will understand. It says, as a BMOH, how will you investigate for the declining? So the first 5 marks is investigation, and second is remedial measures. So you have to see the distribution. Here it is 5 and 5 for investigation and remedial measures. Now in health planning, there are various steps. You have to use that step and incorporate. Now in health planning, investigation is an important step, but subdivisions to that investigation probably has not been dealt there. Like superficially, it is superficially. But since you have to answer for 5 marks, at least you should have some volume to your question. Now, say another question comes up where it says that how will the BMOH approach? 2 plus 3, what are the potential causes? 3, and maybe the remedial measures 5. So then 2 plus 3 plus 5. So you should frame your answer of investigation based only for the 2 marks, right? So your volume will be that. So you can go with the headings. Actually, health planning cycle will only work here. You have to frame objectives. I will do that full planning cycle also in your case, in another question. Okay. In this case, I'll just stick with 5 plus 5. So we will just do investigation and remedial measures. All points will be incorporated in the remedial measures only. All right.
Okay.
So first is situation analysis and investigation. So in health planning cycle, what you say, it's a data collection and data analysis. Since this is a declining sex ratio, so based on this condition, can anybody tell me what are the primary, what are going to be the data sources? One. Abhishek, please answer. Anything, any data source which you feel a BMOH can collect? Let's talk about digital sources right now, digital or maybe record sources, secondary data sources first, please. Abhishek, are you there? Okay, Akanksha, just 1 point, please.
SRS data or NFHS data.
As a BMOH, one will first go to the local level, right? One will look at the, say,
medical registers that is available in the
yes,
health
birth records. See, we are talking about declining
Hospital
sex ratio.
records.
Yes, Abhishek, I could not hear you.
Hospital records.
Yes, definitely. Birth records or birth records of all health facilities. Birth records, right? From all health facilities in that block. So from all the health facilities in the block, what can it be? It can be hospitals, it can be private nursing homes, it can be rural hospitals, it can be any birthing centers, right? Anywhere where deliveries can happen. So first we will check the birth records. Second, Second is analyze RCH portal data. So we are actually talking about secondary data, right? Well, so RCH portal data where there is they deal with sex ratio. So you will see number of live births in the year, how many, you can see the gender distribution of the births and everything. So RCH portal, apart from births also in RCH portal, you will have about services, adolescents, everything in the portal, every data will be there, right? So you can see any gap or any fallacy is there or not. So this is the second point. Third is any other source of data, that is the ASHA and ANM registers. Even ASHA and ANM registers. See, ideally, it is expected that there will be yes, it is expected that a block at this situation 100% institutional delivery, but it can happen that a mother gives birth in the home itself, or somewhere with the help of a village dye or something, right? So you might not find it in the health facility birth records. You might not find in the RCH live birth records immediately. So it will be there with the ASHA. The ASHA will, although it is the duty of the ASHA to report it, but means it will be taken into records later on. But ASHA and ANM registers are also you also need to examine. So as a BMOH, he will do these examination, reviewing, and analysis of the data of the secondary data sources, right? The next thing is he will undertake community survey. So in community survey, what all can he do? Community survey, the first point is he might conduct household survey, right? Especially in villages with, so a block has multiple villages, right? Villages with lowest sex ratios, right? So he can conduct household survey. The second thing is he can interview pregnant women and postpartum mothers. I will provide a proper note, right? Right now I'm just writing because I haven't really prepared any detailed structure. So the third thing is he can assess KAP regarding gender preferences. So he can conduct a small survey or a study to assess KAP regarding gender preferences. And finally, he can do FGTs. What is FGT? What is KAP? What is KAP study and what is an FGT study? Abhishek? Meronissa? Is there a lag from my end? Because people are not responding immediately.
From FGD's focus group discussions and KP's
Knowledge,
knowledge aptitude.
And
aptitude, practice.
yes, Neetu, very correct. So FGT is focus group discussion. So what can he do in focus group discussion? What information can he gather through focus group discussion? Any idea? You want to investigate?
Any social taboos or anything, social preference for a male child or girl child, or what are the
Yes,
issues
exactly.
why they're
So the
not preferring it?
question is declining sex ratio. So you want to, the BMOH wants to investigate the reason for declining sex ratio. What does a declining sex ratio mean? The number of females per 1,000 males is less. Females are even lesser. It is going, the trend is declining, right? So what you want to see, probably we presume, the BMOH presumes that there is some fallacy in the at birth only. People prefer like sex determination related gender preferences. So probably either the female child is not allowed to give, a mother does not give birth to a female child itself. Either she somehow gets to know that yes, the baby in my womb is a female child. So the mother, father, or the family decides to abort the child. So that can be one situation. Second is if the mother has already given birth to a girl child, probably she is abused, she is not given equal importance, she is not fed properly because she is assumed to be a burden to the family, right? So then, like, probably the child might die. There can be infant mortality of a girl child. There can be I mean, these are the possibilities, right? The child can have, like, child mortality rates can go up in that case for a female child, right? So what actually in FGD you get to know, the BMOH wants to understand the BMOH wants to understand the social and cultural factors influencing sex discrimination. See, you have to think stat, right? Even I do not know whether this particular exact question will come or not. But if you have an understanding how to frame the answer under what headings, because probably the main headings are going to be the same, right? So if you can think of something, you can write something. You can fetch, maybe 4 out of 5. If you at least write the headings and write a couple of 2 to 3 lines or points under each heading using your own concept. So in community survey, what can a BMOH do? He can do an house to house, door to door survey. Particularly, he can first identify which village has the lowest sex ratio, maybe last 2 3 ranking villages he can identify, and he can do an house to house survey about what is going on. Second is he can actually interview the pregnant women, maybe understand their understanding the postpartum as those who have delivered immediately about the outcome of pregnancy and how they feel about it. He can do a knowledge attitude practice. It doesn't mean he will do all, but he can do. These are the potential investigations that a BMOH can conduct under a community survey. I mean, during a community survey, right? The second thing what he can do is parallelly he should be going to the facility and do an assessment. Now, facility assessment means what? Means what possibly he can do in a facility. What are the facilities where he can do a survey and assessment? ফ্যাসিলিটি সার্ভে এখানে হচ্ছে ডায়াগনস্টিক সার্ভিস। ডায়াগনস্টিক ফ্যাসিলিটি, ইউএসজি সেন্টার্স যেখানে সোনোগ্রাফি হচ্ছে, probably the sonographers are telling the family that the baby in the mother's womb sex determination হচ্ছে, ঠিক আছে? এখানে diagnostic facilities and USG centers, whatever be the situation in that block, USG centers এ গিয়ে the BMOH may undergo sudden inspection or can understand about the compliance of such facilities with PCPNDT Act. What is PCPNDT?
1994.
Yes, very good. PCPNDT Act of 1994. This can also come as a short question. Please, and go through this. What are the points under this PCPNDT Act? There is another one which is MTP Act. These are related acts, right? So this can also come up. Act. So the BMOH might go to do a facility assessment by doing a survey of the diagnostic facilities and USG centers and check their compliance with PCPNDT Act. At the same time, he can assess the staff training, how frequently they have been trained, what was the last date of training, I mean, how many months back was he trained. The US sonographer, he might be a radiologist, he might be a certificate course sonographer, right? So he want to see his awareness levels. So facility assessment, right? So we had about field investigation. He can do 2 things. One is community assessment and community investigation and facility assessment, right? Now, another set of investigation that he can do is stakeholder consultation. That includes healthcare providers and community leaders, right? In healthcare providers, what can he do? He can interview doctors, radiologists, handwriting is very bad, and technicians. right? And he can check their knowledge about PCPNDT Act provisions, right? Third is he can identify the gaps in implementation and monitoring of this PCPNDT Act. So basically, he is again going back and checking the stakeholders now. That time it was the facility assessment. Facility means it can be, the owners, maybe somebody who is a non-medical, who is not actually doing the sonography, but they are pushing the doctor. They are taking money and insisting the doctor to undergo sex determination, sex disclosure. So in this case, this is the healthcare providers, the stakeholder consultation. The second part of the third heading, it comes community leaders. Now, who can be a community leader in a village or a block? Panchayati
Panchayat.
Raj. Yes, Panchayati Raj institution members. They can be. There can be religious leaders. Maybe for an Islamic population, there can be, whoever their religious leaders are. For Hindu population, they can be influencers in the community. And again, influential community members. So who can be influential community members whose words the villagers follow or who they regard, like school teacher. Maybe in their village there is a retired army person, so maybe he is taken as a with great regard, so he can be like considered as an influential community figure, right? So the BMOH can engage with such people to discuss the possible reasons or to identify the gaps, right? Again, he can understand local customs by discussion, right? Understand local customs and beliefs. Affecting gender preferences, right? And finally, he can assess the community resistance or community support. As Aditya ma'am said, right, resistance, the in-laws decide. So this is the resistance. And it can also be that the parents, maybe there's a nuclear family and there is a girl child in that family and they're happy with that. Like they're okay with that. So again, there's a support. So depending on how your village response is, or how educated the person are, actually such things are not really directly related to education also. Education does have a role, but as Aditi ma'am again said, if you listen carefully, that this such situations are seen even among like educated जिसको बोलेंगे ना so-called high-class people like doctors, lawyers. There are instances which I get to hear in my locality also, though they are well-to-do people, but still there are such situation where there is gender discrimination. They prefer boys over girls, right? So the next point. Now, with all this data that the BMOH collects, the qualitative and quantitative data, what can he do? He can do a geographic analysis. He can do a trend analysis. So, what is this geographic analysis? See, he can identify the blocks and the villages with high. He can identify, right, which village has a low sex ratio, which village has a relatively better sex ratio. He can do a stratified analysis. Probably in sex ratio, those who are poor have a lower sex ratio than those who are well-to-do, those who are on the upper class, middle class people, and those who are in the lower class people. So probably he can identify trends based on or identify data based on socioeconomic status. He can identify data based on geographic situation. I mean, these things can happen. So he will do a geographic analysis based on location. Maybe a particular village is more staunch, more orthodox. I mean, the people of that village probably they are Islamic, and I'm just saying arbitrarily, and they are more orthodox. So, and it can be a particular Hindu family or a tribal village. They are more orthodox. So it can happen, right? So there is this geographic analysis he can do based on the area. based on, there can be a socio-economic analysis based on socio-economic status. Then you can take into account about migration. If the village is somewhere located in the border area, border of Bengal, border of whatever be the case, so he can consider migration data into facts, like, he can check whether how much migration is happening, whether it is affecting sex ratio or not. So these points need to be, so first point is identify blocks or villages, not new blocks, it should be villages because he's a block medical officer, right? Villages with lowest sex ratio. We can map the distribution of diagnostic facilities. We can document migration patterns, which can affect sex ratio calculations, right? Now, there's this trend analysis. What can I do? He can establish baseline sex ratio. You can have a look at the trend of sex ratio, and he can correlate with socio-economic patterns, right? I'm not writing the trends now. Now, what I want you to contribute about, this is the first 5 marks, right? So can you write about the first 5 marks? What are the five or rather 4 headings under which we are going to write our data? Write our answer. First is data collection and analysis. Data collection from primary sources, from secondary sources, and in data, what more he can do? Do a field investigation, which includes community surveys and health facility surveys, right? Then he can do a stakeholder consultation. Stakeholders means there are 2 levels, healthcare providers and community leaders. Then he can finally go and do a mapping and a documentation. He can understand, do a geographic analysis and a trend analysis. So, okay, right. So, can anybody tell me about what do you understand by stakeholders? When you say the word stakeholder, what does it mean? Maronisa?
Ma'am, the persons who are interested in this or they can influence the project.
Yes, a particular institution, a particular project, somewhat related. They are not really, I won't say interested. Yes, one point they have a role, they have a say, they might have monetary or non-monetary advantages. Say it can be, suppose there is a company where the general people, there are some shareholders, right? So they are also stakeholders. Their vote also matters. Again, there is this board of directors. They are the stakeholders. Maybe certain political party. They are the stakeholders. They might be the stakeholders. Now, suppose in a hospital, there can be this administrative body who are the stakeholders. There can be doctors who can have a say. They are the stakeholders. So people who influences has some gain, may not have some gain, altogether are taken into as stakeholders for a particular program or a project. Suppose in National Vector-Borne Disease Control Program, who are the stakeholders in such program? The Government of India, the Ministry of Health and Family Welfare, the at the village, we are talking about the national level. Then it comes at the state level. Then you have the district officers. They can have a stake. Wherever the information passes from the grassroots level till the top, each level has some stakeholder. In fact, the beneficiaries are also stakeholders. The villagers, the block people, the medical officer, they are all stakeholders. They either receive the benefits, I mean, their say also matters, right? When an information passes from grassroots level to the top level, the, I will say, right? It's not a bottom-up approach in certain cases, right? And so from the low-level villagers, information is collected, it is collated, then it is analyzed, it is passed from the village to the block, from the block to the district, from the district to the state, again to the center, right? So there you are getting different levels. So this is something which is like out of the box right now, but I just said. So I want your contribution on remedial measures. The second part of the question is remedial measures. So what can be the first step? Regulatory and somebody read out for me. I won't write. Akanksha, Meronisa, right? You've unmuted. Please write. Please tell Meronisa.
Regulatory and legal enforcement.
The only act we talked about, PCPNDT Act implementation, right? So what can a BMOH take? What action can a BMOH take? He can strengthen monitoring of ultrasound and diagnostic centers. He needs to strengthen the monitoring. He can undertake surprise inspections and impose penalties if there are violations to the PCPNDT Act. He can, like, if he can report it to the higher authorities. He can ensure whether the medical establishments have proper license or not, and whether there is a periodic renewal of these institutions, these facilities. He can establish district level monitoring committees. He can at least suggest monitoring committees for periodic inspections and monitoring, right? And if there is a regulatory enforcement, right? So this is enough. I think PCPNDT Act implementation, that is one point. So next is, I'm not writing, right? So I have written everything for you. Second is community awareness and behavior change. So what comes under community awareness and behavior change? Two headings: IEC activities and community mobilization. Now this is plain common sense. I want you people to contribute. Abhishek, I haven't heard from you for long. IC activities. What IC activities can the BMOH arrange to improve the sex ratio?
Ma'am, role plays showing why, portraying the message that pedicide is illegal
How
and
will he wants to convey the message? How will he convey the message?
using
Information, education, and communication. In that
making
chapter,
posters, he can
yes, mass media approach, folk media approach, radio, television is a bit far-fetched, but radio is there, interpersonal communication,
yes,
posters, banners. Asha can propagate word mouth to mouth through success stories, right? So he should launch an intensive awareness campaign through mass media, folk medias, interpersonal communication, right? He can develop culturally appropriate message and promote value of a girl child. Success stories. He can make sure the success stories about how what are the achievements of a girl child the child has done, maybe, so that the parents might be motivated to keep, yes, the girl child is also like equally like it is good to have a girl child, right? And he can engage the male members of the family, the decision makers of the family. They are the target population. It is usually not the mother who wants to get rid of her baby, right? In most cases, it is always the family members, or maybe the father. They insist on doing sex determination and abort the child if it is a girl. So he can the BMOH must make sure that in such IC activities, either the male members or the decision makers of the family, like the in-laws and whoever, they are included in the awareness program, right? And what is the next thing? The term that I used. Yes, Akanksha.
Can the BMH inform them about the monetary benefits like the Kanyashri program and all? So, like, can we include that point over there?
Yes, definitely. That's a good contribution that you said, that in your IEC, what are the beneficial advantages also? Anything which can promote or motivate the parents to keep their child. Basically, it should be mentioned that undergoing sex determination is a crime, and if found, he may be penalized. right? So sex determination is a crime. So basically, it should be, apart from saying the benefits of a girl child, he should be motivated not to undergo sex determination, right?
It is there in Bengal, no, and some few other states. If you have a single girl child, the education will be entirely free. How many of you know this?
Yes,
पता
sir.
है क्या? पता
बेटी
है ना?
बचाओ बेटी पढ़ाओ.
तो purpose यही है. And this question is not about the data I had given in the morning. ठीक है, जहाँ पे IMR you have seen ना कि there is a contrast difference between the IMR of Madhya Pradesh and Kerala. So you need to think कि why still there is such a high IMR in Madhya Pradesh, and why Kerala has this much of low IMR. And if you compare this data with this developed countries like Japan, what is the IMR in Japan? Do you know? पता है किसी को? It is in the book. It is in Park. But I want to know whether you know or not. Madam, it is only 2. ठीक है? It is only 2.
Single digit IMR.
So you need to study also कि why their IMR is means इतना कम क्यों है आखिर. ठीक है, तो कोई भी डेटा देखेंगे तो यू नीड टू थिंक कि हाँ यहाँ पे करना क्या है. देन ओनली यू कैन आंसर ऑल. ठीक है, खुद से भी डेवलप क्रिटिकल थिंकिंग कि हाँ यदि जापान का देखा तो यू नीड टू थिंक, यू नीड टू आस्क that why Japan has such a low IMR. Only 2. In Kerala, it is around, I think, 6 or 7. But in Madhya Pradesh, it is 43. ठीक है, continue.
Right. So, thank you, sir. Community awareness and behavior change. We were in IC activities. And then now we are going to switch over to community mobilization. Community mobilization means we want to involve the community, mobilize the community. What comes under community? The ASHA, the villagers, the school programs, the religious and community leaders, right? So ASHA, we need to train and deploy the ASHA to undertake door-to-door counseling. Okay, counsel the in-laws wherever possible, counsel the pregnant women that you should not undergo, and if in case you get to know also girl child, what you should avoid. Right. Next, village level meetings with women's self-help group. Right. Third point is conduct school programs to change the attitude among young people. So basically, this is a prevention, if we say, because it is expected that in school program and in schools, it will be probably unmarried children. But if they are motivated from the very beginning, then they might be responsible adults, right? And also the teachers are also involved. So in school programs, you can take an attempt to change the attitude of young people. Fourth is engage religious and community leaders as advocates of gender equality. So if they preach, probably it is expected that the villagers will follow them, right? Because they are taken with very high regards. All right. So please summarize in IC. What will we do? Just 2-3 points. See, you need to write some content, some meaningful logical content under each heading. Right. The first was, since it is a declining sex ratio, we were taking into consideration the regulatory and legal enforcement acts. Right. The second is community involvement, which includes awareness and behavior change, IC, and community mobilization. Right. Okay, we will summarize at the end. Let me go over to the next. I think sorry, I did not prepare the slide. I'll write. I'll tell. Please listen. I will share the notes at the end. Right. The third point is healthcare system strengthening. Healthcare system strengthening. See, this is a very gross thing. In any case, you have to make sure that your health system, and any question that comes, you include this point blindly. Okay, healthcare system strengthening mein 2 things: capacity building and service delivery improvement. Capacity building means capacity building, resource को strong करना है, right? So you have to train your healthcare providers on PCPNDT Act. You need to make sure that maybe you need to develop standard operating procedures for antenatal care without any gender bias. Or you need to strengthen supervision and supportive visits. You need to support the mother in case certain situation happens and the mother is under mental pressure. So maybe she has not undergone an abortion, but people are forcing her. So there should be the health system should be equipped that in case they get to know, if the mother, the pregnant woman says, discloses this to the ASHA, then she should be competent enough to explain or motivate the in-laws, right? So you need to train the healthcare providers and the grassroots level workers how to deal with such situation. So this is capacity building, and next is this also overlaps with service delivery improvement, like you ensure quality antenatal care services. The mother is healthy, she's happy. So these are something which are kind of very overlapping and very vague, I should say. This is nothing related to a sex ratio. It is assumed that if the mother is healthy throughout her pregnancy, she might not consider abortion of the child later on. And if she is counseled properly, if there's a mother, parent, and family counseling, then probably pregnancy will go smoothly. And institutional delivery and monitoring, if she at every point it has been told that she will get free like JSSK, then whatever free checkups under Pradhan Mantri Surakshit Matritva Yojana and anything, if she keeps on getting all free services, probably there won't be financial barrier. So the family might not want to abort the child. So because there is that is not like getting heavy on their pocket. They are getting free deliveries, free transport from the house to the delivery, free diagnostic, free checkups, everything under the Janani Suraksha Yojana and all. Right. So incentives and support schemes. That's the final one. The financial incentives like Pradhan Mantri Matru Vandana Yojana, implementation of Beti Bachao Beti Padhao, providing conditional cash transfers for families with girl children. As I said, what you said, Kanya Shri. It is a conditional cash transfer. 18 years of age may then individual बहुत सारा steps है where they will get, even in West Bengal I think they get a cycle, they get I think 25,000 rupees. Anybody knows the exact benefits under Kanyashri? It has been asked in the question also.
And there are three schemes, K1, K2, K3. In K1 is applicable for the class 10 and K2 is up to class 12 and K3 in the college level.
So what are the benefits under each, like in K1, K2 and K3?
Financial benefit. K2 te 25,000 है और K1 है 10,000 है.
And in K3?
मोटा जानी ना.
Even I
It is
have
also
not
25,000, but we have to be registered under Calcutta University, like for the colleges.
Okay, so a registered student at the college level will get 85,000. Yeah, I'll see to it then.
No, but it's broken down into like years. Like it depends if the person is getting graduated.
Thank you, Deepika. I mean, I will go through this myself also, and I will ask you also, because probably this is something which can be asked, and this is very rampant in the state of Bengal. This is like it is functional right now. And another thing is this, that I think a related question kind of came up in this question paper which I shared, social security for the elderly. So again, it's related. So this thing also can come up, the financial incentives or benefits for an adolescent girl, for a girl child, whatever, right? Or say another situation can come up, that how will you propagate messages, or what are the key messages that you can propagate to prevent sex determination or gender discrimination in a block maybe. So for that, you need to know what are the available schemes of financial benefits. Only then you can write that we will do IC, we will do social support, but we need to give the proper information, right? That this are existing in our state, this should be conveying through IC. Then social support, as I said, recognize and reward families. If possible, reward families. जैसे क्या होता है, there is a function. I'll tell you, there is maybe some event, and there's like in Durga Puja, after Durga Puja, there is this Bijoya Shammilani, right? And Dashmi ke baad it happens where the stages are conducted, people dance, sing, and everything happens, right? In the state of Bengal. So again, students are awarded or rewarded. So maybe somebody is a topper, or there are students in that mohalla or pada who who have done well academically, they are recognized and rewarded. In that case, such mother who maybe is a mother of 3 girl child and all the 3 have done well in their life, whatever, can be rewarded. Recognized, you recognize and reward families. So this will later turn as a success story, and this will motivate the other uh, potential parents, the younger generation, that yes, so and so, they recognize that yes, even a girl child is doing well, so it might motivate them not to do gender discrimination. Then you create support networks for families with girl child. So there is a network where self-help groups or mahila mandalis, where they discuss the potential schemes, if anybody gets to hear any news how a girl child can be taken care of properly. So you can create support networks. Then community based monitoring systems and promote women's economic empowerment through livelihood programs, maybe MSME, small scale programs where women are engaged, like in villages it happens, achar banana, फिर masala banana, फिर weaving, फिर then this katha stitch and all they do, which are handicrafts and stuff which they can do. Mostly females are engaged in such activities. So if they empower themselves, so they can also be a part of the family decision making, and their decision will matter, right? So these are kind of long term far fetched steps. You would not get so much time to explain. Just keep the main headings in your mind, try to be quick, and maybe probably will have 18 minutes per question. So each question, if I take into account say 100 marks ka, and each segment is 10 marks, if I divide, so you will probably get 18, maximum 20, some 15 minutes to 20 minutes plus minus for each question. So you need to think fast, and whatever comes, 2 line under each, 2 meaningful lines under each heading, I think will be sufficient, because we have a number of headings, right? So we can it will fetch you good marks, I think. Then is monitoring and evaluation. Regular monitoring and evaluation, basic periodic monitoring, review meetings of stakeholders, feedback mechanisms from community and healthcare providers. That would be enough. Impact assessment, assessment of impact. Impact is long term. Outcome is short term. So in this case, in this situation, impact assessment, you just need to say maybe sustainability of interventions through community ownership. You document the best practices. You evaluate effectiveness of interventions through periodic survey in the long run. So you can do an impact assessment in the long run, that what interventions you have done, and how your child, how your sex ratio is improving after whether it is improving or not improving maybe next year, right? So this is about impact assessment. So I'll just do a quick revision of the remedial measures. 5 marks, you at least need to mention 5 important points. First point is regulatory and legal enforcement, right? In that we have PCPNDT Act. We are talking about how we are going to do surprise inspection. We are going to strengthen monitoring. We are going to establish committees for overlooking these processes. The third is, the second is community awareness and behavior change. So there are 2 subheadings under that. First is community awareness through IEC activities, and the second is by themselves, that is by community mobilization. In IEC activities, we will talk about mass media, folk media, interpersonal communication by posters, banners, miking, local meetings, village level meetings, folk meetings. As I said, award recognition, these also can be a part of ways of propagating your messages, right? And what are you going to do? You are going to talk about the how to promote the value of a girl child. You will discuss about success stories with girl child, and who are going to be the target members. They are going to be usually the male members, the pregnant women, and the decision makers if it is somebody apart from the husband, right? So decision makers, basically the family should be involved, right? And then community mobilization, what we are going to involve the Ashas and the ANMs to do door-to-door counseling wherever possible. We are going to promote women self-help groups. So the women will form themselves the groups. We are going to include school programs, if possible, train or talk about the sex ratio related concerns. Sex ratio means to avoid sex determination, to give equal gender preferences. We're going to talk about in school programs. Then we are going to also involve the religious and the community leaders to advocate gender equality. Right now, we went from the regulatory, from the doctor level to the community level. Now we are going to the top level, that is the healthcare system strengthening. Right, in healthcare system strengthening, we are going to do capacity building and service delivery. In capacity building, again it comes, we are going to train healthcare providers, we are going to do standard operating procedures for antenatal care, we're going to give proper supervision and supportive care. The clinic should be made available, whatever you want to write, right, whenever free. And then service delivery incentives, you're going to talk about incentives and support schemes. So in healthcare trending also, you can mention about various incentives for the female girl child. It needs to be propagated as well, right? And then you're talking about antenatal care incentives, right? Pradhan Mantri free delivery, free institutional transfer, free diagnostics, everything. So then you're talking about Pradhan Mantri Matru Vandana Yojana, Beti Bachao, Beti Padhao. You're going to talk about cash transfers, Kanya Shri, and anything apart from that. If you know, you might talk about scholarships. So there are various foundations which provide scholarships for a girl child belonging to a BPL, or maybe providing scholarship if she is the only girl child. So there are foundations. You can give a line above that about potential scholarships provided by various organizations and bodies. Then you're going to talk about social support by recognizing and rewarding people who have practiced gender equality, if there is something about, if it is known. Then you're going to talk about support networks. Same thing as we said, self-help groups. You're going to promote village, female economic independence through self-earning schemes, whatever be the case, and establish community-based monitoring systems. Again, the last is monitoring and evaluation and impact. Monitoring and evaluation, you monitor how these are working, how the change in sex ratio is happening, how the life birth and gender distribution. Because if this IC is effective, then the RCH portals will reflect, the hospital registers will reflect probably a better, a higher number of female births than male births, right? I mean, as compared to previous number of female births, because if the community is not aborting the female child now, the female births will improve, the birth counts will increase, right? So this can be monitored, and change in trends can be analyzed later on. I think I will share. I will try to share a point-wise and a structured document which includes all that I have said. But like, prepare a note, and it is not possible to discuss each and every situation separately. So based on this map that this headings and subheadings that I will provide you, you try to frame answers for IMR, declining IMR,